because we're looking for that circadian rhythm. And the circadian rhythm, they should be high in the morning, get your butt out of bed, get you going. It's called the cortisol awakening response, which is also super important for autoimmune, super important for blood sugar regulation. It's anti-inflammatory. And then you want your cortisol down at night because that's when your melatonin comes out. So you want to sleep and, rest and heal. You want your lymphatic system to turn on in your brain. So you want your cortisol nice and low when you go to bed.
So when the timing's off, is it just a matter of let's get your sleep habits better?
Usually, yes.
Yeah.
That's definitely the easiest and the cheapest to start with, for sure.
And are there people who that doesn't work for it? If so, where do you go from there?
Yeah, and it also depends on their day. So it depends on their schedule. So if they're night shift workers versus day shift workers, if they get up at 4 a.m. versus people who get up at 7 a.m. So it really sort of depends on what their normal schedule is. But sleep is what I focus on absolutely first. Are you going to bed on time at a decent hour? Are you off your electronics before bed? Because that blue light goes into the to the eyes. It hits the SCN, the suprachiasmatic nucleus in the brain, and mimics sunshine. So the brain goes, all right, well, I guess it's light out. We should put out more cortisol. And we don't want that. So getting off electronics at night, winding down, dimming the lights, what have you, and trying to get people, to go to bed. And that often, if you can reset your sleep, you can often reset your whole circadian rhythm. But then on the flip side, for those folks who can't get up in the morning, in order to get up, in order to stimulate your cortisol awakening response, you need light into your eyes again. So at this time of year, I'm telling people, either if you live in a place that has sunshine, when you wake up in the morning, first thing, open your blinds, look at the bright light outside or go outside. And if you look, or if you live in an area like I do, Portland, Oregon, which is currently gray and raining, then buy those full spectrum lights. Buy either the box that there are these boxes you can buy that sit on your desk, get a full spectrum light bulb to put in one of your lamps in your room and turn it on in the morning. Because when you get that bright light, it triggers the hypothalamic pituitary adrenal, like, oh, it's the morning, let's make cortisol, and gets it up. And it helps you retrain just by going to bed properly at night and getting proper light exposure in the morning. I mean, that's how our circadian rhythm is governed, is all through light and dark. And it's so cheap. It's so easy.
So I haven't looked into those boxes too much. I think I might get one because right now I get up at around 4:30 or 5, and it's not light for probably 2 hours or so after that. And I definitely have some problems staying asleep, and I guess throughout the day, it's always been a little foggy. So there's some decent research on those boxes that it seems to. Okay.
Yep, definitely. Because they're sun mimickers. And so the light that they emit mimics the sun. And that's what you're trying to get in your SCN in your brain. That light to trigger it to go, all right, make CRH. And then that tells the pituitary to make ACTH. And then you make cortisol.
How much exposure to those is usually recommended?
So you don't have to stare directly in them. So you don't feel like you need to blind yourself every morning. But you just need to have it on around you. So if you're, making breakfast or getting ready for your day, and the boxes are usually portable, just put it on your kitchen counter and then move it to your bathroom counter, and then sort of take it with you, like you would take your cell phone, and just have it and have it on, because you want that light, that bright light, that your eyes can see it. You don't need to necessarily stare at it. But I do know people in my old office, we would have it right on our desk. So as you were sort of in your office sort of charting or doing whatever you're doing, people would have their we call them happy lights. And so they would have their happy light on, and they would have them on for a couple hours in the morning, just to really, especially where we live, which is really sort of gray and dark for most of the year, have them on a couple hours in the morning.
And when do you usually try to start getting away from the blue light? Like 3 hours before going to bed, or is there?
Yeah, so I think research recommends at least an hour before bed. So if you go to bed at 10, definitely by 9. But because where we are in the United States in our season, we're getting dark around 4:30, 5 o'clock at night. And so historically, of course, humans follow the light dark cycle, and historically we would start to wind down, go to bed when it got dark outside. So I tell people when it's 5 o'clock is way too early, but consider switching or dimming the light on your cell phone. Consider you can actually change the background of your cell phone to red.
I was going to ask about that. Yeah. So those are kind of legit, that function.
Yeah, well, I'm hoping so.
Yeah.
I do it. So a couple hours. So usually somewhere around like 6 or 7, I have an iPhone, and iPhone has like quick buttons, and so I have a quick button that'll switch it to red around 6, 7 o'clock at evening, and then I have the blue light blocking glasses. So I have those kind of orange tinged, lovely glasses that I wear at night. And I think I also have I have no affiliation, but I have an Oura ring. And so I track my sleep every night. And the more I I remember to wear my blue light blocking glasses as part of my routine, the better I sleep.
Okay.
The more deep I get, because I'm getting more darkness.
Are you familiar with the, I think it's called Flux or Flux for the computers?
Flux. Yeah.
Okay.
Yep.
Yeah,
yep.
I have that as well.
That as well. Yeah. And they have it for the phone. Mm-hmm.
Okay. Yeah, I
just
figured
changed
it's
my whole
more or less
screen.
the same thing.
Yeah.
Gotcha. I'm not really familiar with the rings at all. How accurate are those? How does it work?
Like people will have like a Fitbit or something, or they'll have an Apple Watch. I actually have never ever had those. I like the ring just because it's super easy for me.
Mm-hmm.
So I have nothing to compare it to. Unfortunately, I can't say, well, just to say this. Now my ring says that. I don't know. But what I do like is that it absolutely seems to track pretty well, not 100%, but probably above 80% of my sleep. Like when I get, like what my temperature changes through the night, my heart rate seems to match up when I just do my heart rate the old-fashioned way.
Yeah.
And then check the ring, respirations, and then when I'm in sleep, REM and deep, and then if I wake up. So if I wake up, at 3 in the morning or what have you, my ring seems to catch it and will show me. It changes on an app. It'll change color. The wake up.
Okay, it's connected to an app.
Yeah. So, and you can turn it in airplane mode through the night, much like most devices. So I just airplane mode it at night. It still records it, connect it in the morning, and then I can see my little graph. And I can for sure see, which I'm sure like people who have other different kinds of trackers, I know what screws me up. I know if I'm up too late, if I know if I have sugar before bed, for sure if I have alcohol, even a glass in the evening, my sleep is completely screwed up.
Gotcha. Yeah, I wasn't sure mechanistically how it works. I've not really looked into it. Like I said, is it just based on your heart rate and temperature?
It's heart rate, temperature, and heart rate variability. So I'm just getting into heart rate variability as a marker of your ability to stress resilience, your ability to handle stress. Yeah.
Right.
So the better sleep you have, the better your heart rate is, and the higher your heart rate variability, which is a better stress marker.